This is Cadillac Unscripted on 107.9 CDY. It's a half hour of local chat on Saturday mornings. It's sponsored by Independent Bank. Katy, Huckle, my co-host, is here with me, and this is a very important show today.
Yeah, I would say it's the most important show we've done to date. And this man is the man of the hour, and everybody wants answers from this man. So welcome to Dr. Jim Whelan. Thank you for being with us this morning.
It's my pleasure, guys. Thanks for having me.
So, there's this little virus going around that's been the talk of the town for about the last 13 months.
Right.
And it's been growing, unfortunately. So, can you tell us where we're at right now in the battle against COVID-19?
Sure. For a little perspective, when this first struck and it started to go crazy in Detroit and then Grand Rapids, we started doing a lot of preparations up here in the Munson system. And we peaked with less than 20 total patients in the hospital during that first surge in Michigan. Come November, December, we had a new peak, and the highest we reached was 84 patients in the combined hospitals. Today, 99. There are 17 patients in the Cadillac Hospital with COVID and 99 across the system.
Okay.
So it's the worst it's been.
It's the worst it's been in northern Michigan.
And that is with roughly how many people in the area having been at least had one shot, one vaccination? Quite a few percentage-wise.
Oh yeah, we've done amongst the best of all the regions in the state in terms of getting people vaccinated. We're over 25% of people, and quite a bit more than that have had at least one dose of the various vaccines. So it's like a race. We have the vaccine race that we're doing well in, but the contagiousness race we're kind of losing.
Can we talk about that for a minute,
Yeah,
Rich?
go ahead.
Can you tell us what we need to be doing so that we win the race we want to win, and so that we don't keep these numbers growing? What do we need to do today?
Yeah. So, thanks, Katy. That's a great question. The situation is that probably, and we don't know the exact proportion, but the more contagious variants are prevalent in northern Michigan, especially the Great British UK version, and it's because it's more contagious. So back in November or December, if you went to church and were contagious, you might have given it to 2 people. But now if you were to go to church or go to somewhere, a crowded gathering, and are contagious, you could give it to 6, 7, 8 people. And then, of course, those 6 or 7 or 8 people could give it to 6 or 7 or 8 people. And that's why the numbers have suddenly skyrocketed.
Okay.
So we have to really re-up our social distancing things, avoiding crowds, wearing masks, washing our hands. Like, we have to treat this like we've been recommending all along, but it's more crucial now than ever that we do this, or else it's not going to peak for a month, and it's going to be twice as bad as it is now.
Oh, no.
So the problem that we're seeing right now is that people are they're emotionally done with it. It's been 13 months.
Oh.
People are finished with it. The weather's warmer. They want to get out. They want to do stuff. And it's just not the best idea.
Oh.
Well, getting outside, we're all in favor of getting outside.
Okay.
It's very hard to catch it in an outdoors group. Okay. If you keep 3 feet away from someone outdoors and you want to have a bonfire and you're staying 3 feet apart, that is probably 100 times safer than going to Meijer right now. And I don't want to, we all have to go to Meijer. Like that, we have to live our lives, but we have to wear a mask if we go to Meijer.
Right.
Okay.
Public places. Yeah.
But the good weather gives us a chance to at least socialize outdoors in a much safer way than we've had to all winter indoors. So I don't want to take that away from us. But I think you're really right, Rick. The healthcare providers are burned out. It's been the longest year ever and the most stressful. And we recognize that. I know it's really hard to continue to hear that same lecture that I'm giving. But because we have the little bit of hope with the vaccine, not a little bit, but a lot of hope with the vaccine, I want people to really feel like there's a light at the end of the tunnel. Like, I'm in a race, I'm already exhausted, I'm barely going to make it to the end, but I can do it because I know at the end I get ice cream. But at the end, right, 4th of July, we can have family gatherings, and we might not even have to wear masks if we just stick it out and enough people get vaccinated.
Okay.
It's interesting because even though there are more people hospitalized right now in the system than there was at the peak before, it still feels like there's more hope because we have the vaccine.
Right.
Am I wrong about that?
No, well, I mean, I know that's how I feel, and I know that's how many of the people I talk to feel. Like, there is hope. Because, honestly, the people in the hospital are not vaccinated. The ones we're admitting are not vaccinated. Across the state of Michigan, there's been more than 2 million people fully vaccinated. There's been a total of 450 of those fully vaccinated people, so 2 weeks after their second dose of the 2-dose vaccines or 2 weeks after the 1 dose of the Johnson & Johnson, 450 total people have been admitted to the hospital. That is a tiny number of that 2 million possible. So the vast majority of people getting admitted are unvaccinated still or only partially vaccinated.
So what do you say now to someone who says, I don't want it. I don't want the vaccination. What would you say to convince them that there's no risk?
I would want to talk to them about why. Mm-hmm. So as I said in the paper, really, for us, and I have my own medical professional bias, right? I won't pretend I don't have that. It's not a political thing. It's a medical urgency that we feel. The healthcare professionals are absolutely convinced of its safety. People worry about the safety. I talk to patients about this every day, but we have to realize, 165 million doses. Like, if there was a pattern of a problem, we'd know.
Okay.
You can't give anything to 165 million people and not realize, hey, 10% of them are dying. Like, that's not happening, right? So we know it's safe, even though it was fast, and we could talk for a half hour just on why it's safe, even though it came out quickly. We know it's safe because we've already given it to so many people. And so I encourage them. I give them as much information as I can about its safety and its benefit. And really, the only other thing we have to look at is the only way each of us as individuals are going to get through this pandemic is you are either going to get vaccinated to get immune, or you're going to get the disease to get immune. Like, it's too widespread for us to have a hope that somehow we'll vaccinate 70% of people and 30% of people will never have to get it or get vaccinated and still it'll disappear. Like, in a fantasy world, that would be true. We've lost that chance.
Okay.
So now you are either going to get sick or you are going to get vaccinated, or you are. That's the only two ways we go forward. So if you're just, even if you're vulnerable and you're hoping you don't need that vaccine, I don't see a way that that's going to work out for you. You're going to. It's too prevalent. We're not going to eliminate it completely until a huge number of people are vaccinated.
So, Dr. Whelan, I had this discussion with a friend just recently because we've all started washing our hands more. Can you tell me how often we should be washing our hands? Can you give us some type of a pattern that you would recommend?
So the sarcastic answer is just short of a dry skin rash. So,
Eucerin.
So, no. So if you're at home, just in your own house with your own typical contacts, you wash it just like you normally would.
Okay.
If you are out in public, so I would use hand sanitizer or wash my hands every time I touch surfaces that are not part of my normal everyday, routine. Okay. The good thing is they've shown that surfaces are relatively low risk, really low risk. So you do not have to wash your groceries.
Good.
You don't have to do extraordinary things. It's after you've touched your face or you've touched a person or a high contact surface, then you should be washing your hands or hand sanitizing. Mm-hmm. And I think that's a little more reassuring. It's far more risky to just be around people than it is to touch things.
I see. And we culturally have this thing where when we gather with family, we hug, and when we are beginning a business meeting or ending a business meeting, we shake hands. Mm-hmm. And that is no mas, folks. When I say goodbye to someone at my office, I kind of give them it was really nice to meet you. And I've got my mask on and my eyes are blink, blink, meaning goodbye.
Yeah.
And everyone seems to be fine with that, but it feels awkward.
Yeah, I think yes, I agree. There's various people who are probably thinking, wow, this is great. Now I never have to hug anybody again. But
it's misery for the huggers, though.
Yeah, it is. It's very hard.
It's so true.
It's just part of the laundry list of things that have changed in our lives that feel disruptive.
Mm-hmm. Right.
And so I think a quick talk about all that stress and how people are feeling overwhelmed and stressed out by this. We don't want people to feel isolated and stressed.
Okay.
Reach out, talk to other people, find ways to connect, especially now it's outdoors. Go for a long walk with your friend outdoors. You can do it safely. If you feel better with a mask, great, wear a mask. But get out, start to reconnect in a safe way. But that isolation has been dangerous and harmful, and we wish we didn't have to do that. But the emotional toll of this, we're all going through it in our own ways. I think we need to really be talking about that and making sure people are staying connected on some level to get us through this next however many months it takes to get through it.
You know, Dr. Whelan is the type of doctor that very diplomatically keeps it real in his office. Okay, I can tell you about that personally.
Yeah, personally.
Okay, and so can you tell us when these mental health issues happen? There's after effects. Like I have a girlfriend who texted me really and said COVID-19 meant I gained the COVID-19, and so I think we're seeing, aren't we?
Oh yeah.
What are other health issues besides the illness itself that causes, when people get stressed out, how can that manifest itself physically?
So it's really, I think that's a great segue, and I want to touch on that two different ways. One is stress can make us sick.
Okay.
Like, so if we are fretty, like it's sometimes at the point, especially if you're either have had a scare or just are naturally hesitant or afraid or feel vulnerable about getting sick, it has made us afraid of our friends, and it has made us afraid of strangers just to even be around them.
Yes.
It's made us angry at someone we see walking around with a mask below our nose. Like, anger's not healthy. That when we feel angry at someone who's just, whose mask has slid down, that's because we're also feeling super stressed. So we just have to recognize that in ourselves and then do some self-care. That's where getting outside, get in the sun while it's nice, do some physical activity. A lot of people have done that self-care by eating all winter. That's okay. Like, do not stress about the COVID-15. Let that go and work on it this summer. But that's okay. If that was your way of coping, no one's going to give you a hard time about it.
You can fix it.
Yes.
Okay.
And so, but we each have to have our healthy coping mechanisms. I think we really have to struggle with that. The other part is, it scared some people about going to the hospital or the doctor's office so much that we have a very large number of people avoiding care and then
That's dangerous.
showing up much sicker than they would have if it wasn't COVID time. And so
yikes.
we really, in the hospital system, want to emphasize that it is very safe to get your care at the hospital. Don't delay your mammograms. Don't delay your colonoscopies. We can do those all safely. Between vaccinated staff and the processes in the hospital, we can make it safe for you to get the care you require to stay healthy, and that's really important.
If I haven't had the vaccination yet, but I do have a surgery or a procedure scheduled, I should not be scared.
Correct.
Okay.
We have a very good, we've tested it, just like we've tested the vaccine on 165 million people. We have tested the process we have for screening people, pre-operative testing, and appropriate protective both equipment and processes in the ORs, that it is very safe. We have not given COVID, no one's caught COVID in the hospital from coming to the hospital for routine care. We've had one patient over a year who arrived COVID negative, was hospitalized for a long period of time, and tested positive later in their hospital stay, which is much better than most hospitals managing COVID patients for a highly contagious disease. But we know we have the right processes. We feel it's very, very safe to come in.
Okay.
Good time for a break. I've got a couple of questions teed up, and I know you've got a lot of things. This is, as you said, probably the most important show we've done in the 15, 16 months we've been doing Cadillac Unscripted. So we're going to take a break and spend another 15 minutes or so with Dr. Jim Whelan from Munson Healthcare Cadillac Hospital and 107.9 CDY. Back to Cadillac Unscripted on 107.9 CDY. Very important show today, Katy. We have Dr. Jim Whelan here with us, and
I like to call him the boss.
the boss. You have a past history, the two of you. You were telling me before we started the show.
Yeah.
He delivered your first son.
He sure did. He did an incredible job. So
Yeah.
when Dr. Whelan says jump, we say how high.
Except when you're 9 months pregnant. Maybe you
Okay,
shouldn't
well
do
then
that.
you say, what do I do next? Yeah.
Katy could have jumped pretty high when she was 9 months pregnant.
That's funny.
So one of the great things about having you here, Doctor, is we want to dispel myths to get rid of misconceptions that are out there. several variants out there. We've established that they are more transmissible than the original one, than the previous one. Does the vaccine address the new variants?
So obviously we're still learning some as we go along on how effective. But what we're seeing in areas where the variants have become most prevalent is that the vaccine is still highly protective. In fact, right now the current belief is that it's more protective than having gotten sick with the original variant or the original COVID-19.
Wow.
So that's why one of the reasons why we're encouraging even people who've had COVID to get vaccinated. It's just like a booster that's going to give you even more immunity. Are the vaccines as effective against the variants as they were against the original? Probably not as effective. So we go from 95% effective to, some lower number, but still much better than just catching it. And so we still encourage vaccines. They are working on boosters that might be beneficial for the variants if we get to a point where suddenly well-vaccinated people are getting sick, but it would have to be a new variant, not one of the ones that are currently circulated. We're not seeing vaccinated people get sick from one of the current variants.
Okay. Katie, go ahead.
Well, what I wanted to know was when this all rolled out, and all of a sudden, I think as a country, we were shocked by the discrepancies state by state on how this was being handled. And so, it doesn't matter what your politics are. Michigan handled it a certain way. And I just want to know from a doctor, in a leadership position, a doctor who's both a leader in administration, but also as a physician, how you felt about how Michigan handled it.
So I think everyone in northern Michigan should be extraordinarily grateful for how we restricted things early on, because that saved northern Michigan from the first surge.
Whoa, okay.
When the governor shut down travel, that kept it from spreading from the hot spots in Michigan in that first surge last March, and saved northern Michigan. It gave us time to prepare.
Okay.
And there is no question that there is a straight line between relaxation of restrictions and rising cases. It's not all one kind of restriction or another. And I think Rick really hit it on the head when he said we're all exhausted and it's very hard to stay as rigorous this long. Mm-hmm. But the more relaxed the restrictions, the faster cases go up. And that's not just true in Michigan. That's across the country. So I understand there needs to be a balance. Like, we can't go 18 months with the entire world not driving anywhere. Like, that will cause mental health issues. There's other things we have to take into consideration. But the restrictions help slow the spread if they're followed. That is not unclear.
Okay.
Mental health. I know you talked about this earlier, Doctor, but, I spend my days with about 50, 16, and 17-year-olds. And I have never seen, in the grand scheme of things, a worse mental frame of mind amongst our teenagers. How can that obviously nicer weather helps, but how do you address that in a younger
how do we help them?
To a younger brain who doesn't really think beyond next week or even tomorrow?
Yeah. I really think that the last 2 years of high school seniors are probably the most emotionally impacted by this. The huge milestone celebrations that normally go with them, proms and graduation parties and things like that, were largely robbed from them. And there's no way we can go back and undo that. We couldn't say that, at least if things are trending the way they are now, that graduation parties are a good idea this year. But I do believe and that total uncertainty for those younger high schoolers. Like, that is the time. So middle schoolers, they're not really paying good attention to the news, right? They're just living their lives, but they don't feel anxiety about the future. By the time you get to ninth grade, you start feeling anxiety about the future and realizing, wow, it's really become unpredictable. Like, everyone comes home and doesn't know what's going to happen next week. Am I still going to be working? Am I going to be shut down? Am I going to school? Am I staying home? That uncertainty is very disruptive to kids. So I would empower them to, learn as much as they can about it, take charge of the things they can, understand as well as they can what it's going to take to get to the far end and get to back to how they want to live their lives, and try and encourage them to really focus on that if it's possible.
I have a 9 and a 10-year-old, and I tend not to turn the news on. I don't want them to see the gloom and doom, because the gloom and doom is all they see. They don't see that there is a light at the end of the tunnel, you know?
Mm-hmm. Well, and Dr. Whelan, at break, we were talking about there are folks that truly believe that the sun's not going to come out again after this, and that we're not going to be able to have gatherings. And I know you can't predict the future, but can you give us some of your thoughts about what the new normal is going to look like?
Sure. I will admit, and I have probably been one of the more widely quoted people over the past year because of my role at the hospital and the desire for knowledge, that I have made 100 times more wrong predictions than correct predictions.
Okay.
Trying to anticipate human behavior and things that we can't predict. I've been wrong more than not. But I think the trend right now, really the amazing pace of vaccinations across the country and everything, gives us hope for the middle of summer to be at a point where cases are very low, and we can start thinking about safely traveling and safely gathering and going to concerts and baseball games. Will there be a time where we really say we never have to wear masks again? Or that there were 0 cases in America for the last 2 weeks? I would love to predict a time for that. I'm not going to predict that right now. I think I can't give them that, but to the point where hospitalizations are barely above normal or are at the same as they used to be or whatever, I think that's very realistic by the end of summer. And so we'll never. I don't know that we'll ever feel totally normal again. Like, will we ever just get over the fear of someone who's coughing behind us in line? I don't know. Mm-hmm. But will we feel so much more normal than we have for the past year that it'll feel like normal? I think that's going to happen this summer.
Oh, that's wonderful. When you look at other pandemics, you hear, our grandparents talking about ringworm or polio, how does this compare?
So the biggest pandemic we can compare to is the Spanish flu.
Okay.
1916 to 1918 or 17 to 19. I'm not a historian, and that killed 10% of the world's population.
Oh.
That's a humongous number. We're nowhere close to that. Like, it's still devastating, and we are much more conscious of it. So in 1917, they didn't have a daily count at the start of every newscast telling you exactly how many people died today. Mm-hmm. But it's estimated 1 out of 10 humans on Earth died during those 3 years from that flu. So that's much worse than this, but that's our closest comparator really right now to that. And so this is a generational. It's maybe the worst we'll see in a century in terms of an infectious disease or any kind of health crisis in our lives, for sure.
So let me ask you, because this is on the forefront, we don't know what the timeline looks like, but that there's a general consensus out there that you'll need a vaccination card to be able to fly. How do you, I haven't seen it yet. How do you as a physician feel about that type of a restriction?
I'm very uncomfortable because I really think equity is what we have to focus on, and access to vaccinations has not been perfectly equitable. It's been pretty good. But I never am totally comfortable with the idea of, only a portion of the population can do something because they happen to have access to the vaccination or were willing to get it. We're going to really have to struggle to navigate that. It's just like companies mandating the vaccination versus not. Mm-hmm. Like, on one level, it's easy for me to say, yes, it's mandatory. Like, healthcare's, if there's an area where I think it should be mandated, if anywhere, it should be healthcare. That said, it's hard to really go all that way and say we have to do that for everyone.
Okay.
Because we maintain this part of America that gives us that flexibility.
Mm-hmm. It's a freedom.
It is, but philosophically, now we're wandering off of just medical science, and I admit that. But the same philosophy that we want to have that choice to not get vaccinated, with that are consequences. Like, we have to accept the responsibilities for that. If we are going to act irresponsibly when we're not vaccinated, I'm much more uncomfortable with that. That's kind of hypocritical. Like, this is my freedom. I can do what I want. But that doesn't mean you get to impose on everybody else's freedom. You don't get to talk. You can't make fun of them because they do wear a mask. You can't give people a hard time because they do get a vaccine.
Yes.
Like, it's a fine line.
Right.
And we have to understand that not being vaccinated and not wearing a mask, you put other people in danger if you're carrying that virus. And there's a responsibility that we're not really seeing. And until that's more consistent, I don't think we've really reached the balance point between requiring and offering vaccinations. So, we all have our own potential solutions. All I ask is that we act responsibly in both cases. That's really what we have to ask of each other.
Okay.
In the last few weeks, Dr. Whelan, we've seen younger people getting sick. Is this because the older population has gotten the vaccination, or is there a different explanation there?
Definitely in hospitalizations. The average age of hospitalizations now versus November, December surge, 10 years younger.
Okay.
Because well over 50% of 65-plus-year-olds in our counties have been vaccinated. In some counties, over 75%. So they are not getting as sick and going to the hospital in the same proportion. So if we imagine how many people are actually carrying the virus right now, it is much, much, much higher than it was in November and December. But because they're younger and generally healthier, fewer are going to the hospital, and yet we still have more people in the hospital than we did in November and December.
Boy.
So it's really hard to kind of visualize that, but it is younger, healthier people in the hospital, and it is because the older people are vaccinated. And so, I mean, that's good. We're having fewer deaths proportionally. But the people who are in the hospital are very sick, and you don't have to read the paper or watch the news to know that the obituaries still keep rolling on. And that's what's really heartbreaking for us in healthcare, is feeling kind of helpless in some of that.
And we go back to what you started the show with, is that people have disease fatigue. And they're just feeling sort of hopeless. Like, well, people are still getting sick, and I've been wearing a mask this whole time, and I'm sick of this, so I'm just going to go do my thing. And that doesn't work. And I think consistent messaging from the healthcare community is so important. And I wanted to ask you, Dr. Whelan, if someone wants information, let's say they don't want to wait for the news, or they don't want to wait to read the paper, or they want it now, where do you send people for data?
They should talk to their primary care doctor first.
Okay.
They're on the front lines. We have 100 ways for them to get information. The Munson Healthcare Internet page is filled with data regarding local cases, the status in our hospitals, and all kinds of factual information.
Great.
District Health Department 10 webpage, great resource. MDHHS for the whole state of Michigan, a great resource for information.
Okay, good.
I will tell you that my wife hasn't had hers yet. She's about to have hers, and it was so easy. We sat at lunch after 26. I popped open my phone, went to dhd10.org, scheduled it. It's easy. There's no reason why you shouldn't do it.
Every pharmacy, District Health Department 10, all the primary care offices, get your name on every list, and you will, get called in a relatively reasonable amount of time.
Get the first one available and then cancel the other ones.
Yeah, tons of people want the Johnson & Johnson because it's one shot or whatever. We're really very much at a stage now where just take whatever they'll give you first. Like, even after one shot, you start being protected to a significant degree of the Moderna or the Pfizer. So just get what you can. Side effects, no difference. Like, we're not seeing any more or less side effects with them. We're not seeing any more or less complications with them. And they are both very, very safe technologies. People worry that it's too fast. Realize we're using technologies to make these vaccines that we've been using in medicine for well over 10 years. In the case of the Johnson & Johnson, for well over, who knows, a very long time. This is very safe technology that we've used to develop this, not brand spanking new.
We have had just a ton of great information here in the last half hour, Katy.
We sure have. And my last question to our medical leader during a crisis would be, what do you have to say to the Cadillac community about keep the faith, stay with it?
Yeah, I am the prize, right?
Right.
So we think, we want to be able to have, I've been telling my patients since early spring that if you want to have your big family reunion that you've been missing for 2 years, we got to behave. Like if we want to achieve that end of summer freedom, we got to behave right now and get vaccinated, and that is a possibility. And it's just, we keep saying just a few more months and a few more months, but it's real now with the vaccine.
Take action.
Yeah, or inaction.
Mm-hmm.
And
but you hate to oversimplify it, but it's like parenting. If you behave, you're going to get the cookie after dinner. That's really what it is, right?
To a large degree.
Yeah.
But usually we're asking our kids to do much less difficult things than we're asking everyone to do.
That's true.
And we understand that balancing act. Like a lot of people are feeling like people are criticizing them for their behaviors. You have to find your balance. You have to find your coping, right? Like, it goes back to what I said about thinking about other people. Like, make your decisions. You can put yourself at risk. Like, it's America. Like, we all drive. We all drive different ways. Some text and drive. Like, you can make those decisions. There's consequences, but you can make them. Make your decisions so you're not putting other people at risk. If you want to take the risk, great. Don't put other people at risk. That's all we're asking.
Man of the hour right here, Dr. Jim Whelan.
That's the perfect way to end it. Dr. Jim Whelan with us today on Cadillac Unscripted, sponsored by Independent Bank. Thank you so much for your time, sir.
Anytime.
All right. Join us next week, same time, same station, for some more local chat, sponsored by Independent Bank. Cadillac Unscripted on 107.9 CDY.